Hello and welcome back to Kinda Hot and Kinda Healthy with your favorite hosts, Maddie and Allie. And today we have a guest that Maddie and I both work with. And Maddie works with her. Like, how would you describe it to people that have no idea, like the worlds that we kind of work in? How would you describe you work with her?
So she is my mentor and my coach. She
And
helps
her
me
name,
with
sorry, we didn't drop that. Dr. Kelsey, who is a doctor
Dr.
of
Kelsey.
chiropractic and pelvic floor specialist.
Yes. She is. Oh, I don't know what's going on with my coloring here. There
Your
we go.
lighting.
I know it was like going into the dark. That was weird. But she is my mentor, so she helps me with my clients, helps them move better, helps me figure out how to assess if they ever having pain, their workout programs, all that good stuff. And then she's also my coach, and I hired her because I had chronic back pain and hip pain for literally like my entire life. And I was like, you know what? I want to learn how to fix this. And everything I'm learning with her, I have been able to apply to my clients and be a better coach for my clients. So that's been really cool. How do you
I
work with her
love that.
exactly?
Yeah, she is my nutrition coach, and I think it's really important for us as coaches to have coaches and to have mentors because as Maddie just said, she applies the work that she does with Kelsey to her own clients. And similarly, Kelsey and I, when we are focusing on my nutrition, we have such great and like deep conversations that have also made me a better coach and I'm able to approach working with my clients in a little bit different of a way than I would have before. And so we do a lot of mental health focus as well, which we do not cover on this episode today, but we are going to have her back and do a deep dive into that because weight loss is not just about the diet and the exercise. Like that's a great place to start, but we also need to
Mhm.
address a lot of the issues. Kind of like with your back pain. You know, we dive into it
Mhm.
in the episode, but we can't just have like a one quick fix thing. Let me go to the chiropractor and we're all set. You know, it's a lot of in-depth things. And so we're really excited for you guys to hear it because it was awesome. And the time flies by. I mean, you guys listen to the podcast, you know we like to talk.
Oh, we dove into chiropractics, therapy, mental health, postpartum, prepartum. What do you call that before birth?
Prenatal and postnatal.
I don't know what I said. We dive into all the things, and we will definitely, like Ali said, have her on again.
If you're new
So
here, Maddie doesn't want children, so we do not shame her for not knowing the words.
anything. Oh yeah. If you are here just to listen to Dr. Kelsey, welcome.
Yeah.
Welcome to the chaos of kind of hot, kind of healthy. I'm sure you will love us. We are going to be having Kelsey's our first guest we're having on.
Yes.
We're planning on doing about one guest a month. If you want to apply to be a guest, you can just DM us. But we're really excited for you to listen to this. So I hope you guys enjoy. So I think there's a great way we could start this with our friend, mentor, coach, Dr. Kelsey, is just talking about why we wanted her on here. And I feel like she is just a great example of supporting women and also just being a health professional that really touches on like subjects and health that a lot of doctors tend to kind of just say, oh, it's just female problems. Oh, it's just like that's normal. Just take ibuprofen, or oh, your back is going to be hurt forever. And that's probably one of the first reasons why I wanted Dr. Kelsey on here with us. And Allie, is there any specific reasons why?
Well, yeah. So we've talked about it before on the podcast, but I had like previously a horrible relationship with a coach and gained a lot of weight. And I was literally sitting, we were in the ski lodge skiing, and Kelsey posted something on her story. And I was like, okay, just gonna apply to work with her. Like that was it. I don't even remember what it was, but I messaged her in that moment and I was like, you just got an application for me. I like felt like a kid. I was like, I'm so excited. I need to tell her. And she's somebody that like I value and trust on like so many levels that I wanted like our audience to get to hear from her and learn from her because again, like there are so many women that like struggle with, oh, I pee when I laugh. And they're just like, it's fine. And that is like, okay, let's talk about these like real things that are actual problems. And like, let's just not like put on Depends and like hope for the fucking best.
I
Amen to
hope
that, Allie. Amen
I
to
hope
that.
you are excited to be here as much as we are to have you.
I am so excited. I love y'all's podcast. Like, I love the just like girl talk vibes of this podcast. It's so fun. And I'm just so excited to be here. Like, you guys are both amazing clients, and I love working with both of you because you just both like genuinely want to show up and be better and learn. Like, Maddy, I learned so much by coaching you. It's unbelievable. Like, the conversations we have, I'm like, oh my gosh, like, it's like your brain works that way and my brain works this way. And it's all for different reasons. But I'm like, oh my gosh, I've learned so much in this one conversation with Maddy, and how to communicate with people and how to talk to people about their problems, because what's going on in your brain isn't what's going on in my brain, right?
Okay, so
It's
that's the
probably
real
because
reason why we wanted her on, just to like boast us and talk about how fabulous we are.
Well, I will say, I feel like Kelsy learns a lot from me because my questions are so remedial. I'm like, well, why does that happen? And she's like
Yeah.
thinking on this like higher level.
Yeah, but
Yeah.
I think that that's kind of like a superpower that like Maddy does have, because sometimes I will take things at like face value and I'll be like, okay, cool. Like I'm gonna do this because like this is what it is. Like I don't need to dive deeper. And so I also feel like sometimes Maddy makes me question things where I'm like, wouldn't have done that, but I am like going deeper. And so Maddy, what exactly, like in the capacity that like you work with Kelsy and like explaining like your dynamic, because we're both kind of at different spectrums of the way that like she uses her expertise to like help us and educate us. So
Like, what
Kelsey,
do
kind of Kelsey share that, like
Okay.
your perspective, and then
Okay,
I
you
want
want
to
me to
hear
share? Okay,
Maddy's
yeah. I don't
perspective.
want to like,
Gotcha.
I don't want to like talk about what I work on with y'all if that's not like a cool. I know you're super open on the podcast, but I just didn't know, like, yeah. But yeah, Maddy and I started working together about 4 or 5 months ago now on her, mostly her back pain was the biggest issue that she had. And it really just boiled down to poor mechanics. Like, when push came to shove, it was a very mechanical related pain. There was no like, oh, I blew a disc, or, oh, I, was in this car accident, or like, there was nothing like traumatic that happened. She was just walking around every day in pain. And I would hear Maddy talk about that in different circles that we were in as like overlapping as coaches. And I would just be like, oh my God, I want to help this girl so bad, because it just doesn't have to be that way. And, Maddy mentioned in the beginning of the podcast, like when you go to the doctor and you're like, hey, I have pain, they're kind of like, that sucks. Like, they don't really do much for it. And I
Yeah.
can't tell you how many times over the years, whether I was practicing as a doctor or in the virtual space, that I've heard women say like, yeah, my doctor just said, yeah, you have pain. Like, okay. Like, and they don't have any answers, but it's really just because doctors don't necessarily understand pain. And I'll even take that a step further to say that a lot of even doctors that have the same credentials I do don't necessarily understand pain or treat it in a way that's evidence-based and scientific. And that's what Maddy and I work on together, is not only addressing some of her mechanics, but continuing to improve her mechanics. And one cool thing, Maddy, that's happened since you've come on board is one of the first questions Maddy had, which is one of those Maddy questions, was, I don't want, as I started addressing my mechanics, like, I don't want to lose my gains. Like, I've worked so hard to build what I have. I don't want to lose my gains. And since then, Maddy, what has happened?
I've gotten even better gains.
You've gotten even better gains, because at the end of the day, muscles that don't work don't grow. If your
Yeah.
muscles don't work, they're not going to grow. If you're walking around going, oh no, why am I not toned? Or whatever the verbiage that people use nowadays is, like, oh, why am I not toned? Like, if your muscles aren't working, how can they grow? How can they burn calories, right? If your goal is fat loss, if your muscles don't work, they're not burning calories. right?
Yeah.
So this conversation goes way deeper than just like even the pain. If we want to talk about then like client results and fat loss and weight loss and all of those other things that we work on with clients too.
100%. And, Maddie posted a picture the other day and she's like wearing like skinny jeans. And she was like, oh, like this is like whatever, like you were like thinking it was like chuggy and millennial and embarrassing. And I'm like, I literally can't stop
Illegal.
illegal. Okay. I can't stop looking at your ass. I'm like, holy shit. And like, I know you've posted like before, like your kind of before working with Kelsy and then working with Kelsy and like your like glute transformation. And I was just like, yeah, like this is the shit that kind of like gets people in the door. I know Kelsy and I talk a lot about like what is going to get us in the door. And for people to kind of realize like maybe pain isn't going to get me to care. Like, oh, whatever, I'll just pop some ibuprofen and like hope for the best. But to see like a real life transformation, like, oh shit, like maybe that's
Mhm.
why I should care to focus on listening to pain and working with my body versus just settling for like oh, you're in pain because that's what happens when you get older or whatever, like a lot of doctors just kind of like write off.
Yeah, and I think for me, a part of it was like it's maybe, if I'm being totally honest, like slightly embarrassing to be like, yeah, worked a lot on mechanics because I try to pride myself on being like I move well, I try to move well best I can. But I think as coaches, and I'm sure Kelsey can also like relate to this in some way, like we are always learning. And I think I have less shame about this now that like I'm always going to try to improve in my own things, my own nutrition, my own movements, because in improving on that, I'm also bettering myself for my clients. So although it's like kind of sucky to be like, yeah, like I had back pain for years and hip pain, and I used to go to the chiropractor like religiously 8 weeks on the dot, get adjusted, get my back put like back in place, what it felt like. And now I haven't gone literally and since I've started working with Kelsey, because I don't wake up with that constant pain anymore. And I'm really happy about that. And all the things that I'm learning with Kelsey, like I'm applying that to my clients always. Now I am like, I see more things, breathing patterns, like all of these things. So I think as coaches, having a coach is so true because I mean, Allie, you work with Kelsey with nutrition as well. I don't because I'm working on my autoimmune, but we learn more things working with other coaches that are no more than us, and are better, have a bigger, more specific expertise for what we want to learn in.
Yeah, I
Yeah.
agree. Yeah. And I'm curious, Kelsey, where did you start? Like what was that story for you to become? Because Maddie and I were talking about this on some episode, like how we got into the online space and started and working with the clients that we do, because we all are coaches, but in that we are so specific with what we do and who we work with. So you came from like a clinical setting and then you kind of transformed and changed. And what was that driving factor for you?
Yeah. And I think to tie in kind of Maddie's last comment is that, as coaches, like we're all here because we have some kind of story about how we really sucked at this to begin with, like that's kind of all of our story. And that's one thing I love about y'all's podcast is how open you are about like, hey, yeah, in high school, like this is what I did and this is who I was. And like, it just freaking sucked. And that is very much so part of my story too. I started off my career wanting to do physical therapy. And when I was in college, I started interning and I just was in these clinics with like these people that had back pain. And it was like the person's, 300 pounds. And I'd be sitting there as the like dumb intern in the corner being like, is no one gonna talk about that? Like, we're really just gonna have this person like sit here in child's pose and like, do some cat cows and say like, oh, you're fit. Like, no one's going to address this person from like a holistic standpoint. So I dropped out of PT school and ended up in, personal training and chiropractic. And it was really just like, it was a combination of realizing what I wanted and how I wanted to practice and addressing a whole person. And also a combination of that and COVID just kind of falling into my lap and like circumstances. I was practicing working with pre and postnatal women in a clinic, and they would find me on social media, and they would all see that I was a bikini competitor, and they would be like, "Oh my God, can you write me a program? Blah, blah, blah." And I'd be like, "No, sorry, I don't do that anymore." And then COVID hit and I had a business, and it was just that simple. But it was really then kind of like thinking and being like, wow, I can actually help that person so much more in the online space than putting my hands on them. Because at the end of the day, like to Maddy's point, a chiropractic adjustment is really just a manual version of Tylenol, right? You have like some biomechanic, improvements that are temporary. You have like some sensory input that affects your neurology and all this stuff. But at the end of the day, the only thing that really happens is like you're temporarily like, wow, I feel better. And then like within a couple of days, you end up going right back. So I think hands-on medicine absolutely has a place, but at the end of the day, if you want to change tissue structure, you need to be in the gym. Period. End of story. You need to be picking up heavy shit and put it down. That's how we change tissue structure. So having that like conversation with myself helped me get out of like, I need to be a doctor in this setting and like feeling like I needed to check that list, and helped me transition virtually. And I'm able to help people in such a more holistic way.
I
So
love that. Yeah. You go.
Are you, sorry, we're going to be probably doing this a lot.
That's okay.
Are you anti-chiropractics, or maybe there's like a time and place? And then, because I feel like we've talked about this in our mentorship, where you said the best thing to do if you're getting an adjustment is to do your rehab or do a workout right after, so you're working in that range of motion that you just opened up. Is that about right?
Exactly. And that's my exact stance, right? Is that I'm not against it, but I'm very against the way a lot of people communicate about it. Like for you to say that like I needed to come in every 8 weeks for my doctor to realign my spine. Yo, if it was that easy to realign a spine, like your spine can't just be realigned. Like if that was a thing, we would all be super fucked up. Like if it was that easy to just like, boom, my spine is like out, boom, is that like, we would be so fucked up. Like it's not that simple, right? Like that little popping noise is just air coming out of the joints, and it helps us feel better, increases our range of motion. And that is a great time to go and do rehab. That is a great time to go and move because you feel better. Right. So like it absolutely has a time and place. But I mean, we even know a doctor like my husband knows, who tells people that he's popping their discs back. That's what he tells people. And I'm like, you should be like, my husband and I have talked about like reporting him to the board so many times, because that is like absolutely like scientifically not what happens during an adjustment. Like, so you really have to be careful to who you listen to out there. It is so scary, like the world of musculoskeletal health. And that's like, again, that's people that have degrees, right? Like that's not even touching like the crap that comes out of some MDs' mouths or orthopedists, or like people that like don't actually maybe necessarily have the rehab knowledge, right? So anyway, it's just a scary world out there.
Yeah, no, I feel like, not to go down like this tangent of chiropractors, but as someone who grew up going to the chiropractor from a very young age, because #gymnastics like broke my back, not really, but like felt like it. We got sucked into one that was in our area. And I remember, I don't know if anyone has this experience, but like, it was like one of those places where they have like all these rooms, and then like one room we were like on this like bed, and it was like a massage table, and I remember like laying there, and it was like the thing came down, and then another room is like where you do like the exercises, and then the third room is like where you get adjusted. But there were like hundreds of people like going through in a circle. I mean, we were going like 2 times a week for years. 4 years. I'm like, I can only imagine how much my parents paid, because they thought, oh, this is helping us, and this is getting us moving in the right direction. But at that time, were they exercising and eating more protein and healthier and lifting weights? No, they weren't.
Right.
Yeah, and it's like, I laugh at the thought of certain chiropractors like making all these claims, because like I'll go down the rabbit hole on TikTok of like watching
Same.
like crazy chiropractor videos, and I'm just like, like, I'm, like, cringing watching because I'm like, "Oh my god, like, what are they doing? This is crazy." And
Allie, your
I
anxiety does not need that.
no,
Please.
no.
No, no,
But
it
it's
does
like
not.
it's so crazy because right, like, there is a time and a place and using different techniques and therapies together, but I do believe that a lot of people that go to the chiropractor think it's, like, the end all be all because that's all they're being told. Like, I went to a chiropractor, like, several times in high school, and all he did was, like, "Okay, walk for 15 minutes after, and then, like, I'll see you in, like, 4 weeks." And it, like, did feel better in the moment, but it never actually, like, addressed the problem, and so it's the same with thinking about, like, fast fat loss. Like, yeah, you can diet down and eat practically nothing and lose weight, but, like, does that fix the problem? No. Like,
Mhm.
it's a little Band-Aid, and then it's gonna be a disgusting wound when you open it back up because you didn't take care of it properly. Um,
Mhm.
and I think it's so interesting that you have this perspective even, like, in a clinical setting, like, you're seeing people, you're like, "Oh my god, like, what is this person doing?" Like, they are qualified, but what the hell are they saying to these people? Like, it's
Mhm.
crazy. So I love that you're able to actually help so many more women being online and giving them information that they wouldn't have known before. Like, it wouldn't have even, like, been in their realm.
Yeah.
Yeah.
I have
And
another question. Oh, go ahead.
mm-mm, mm-mm.
I feel like we're gonna have to you on multiple times because me and Allie go on side you've listened, we go on side tangents
I
like
love
for all.
it. I
I
love
think
it.
I can't remember which episode it was, but all we did was catch up the whole time.
Oh, yeah, it was, like, scary stories, trauma
Oh,
dumping. I was like,
yes.
"What?" Oh, we were here for an
Else.
hour and a half. It was amazing.
Okay, anyway, since okay, now we know your stance on chiropractics and getting adjusted. What is your stance on getting like deep tissue massages?
Again, everything has a time and place, right? I will
Mhm.
say a lot of the research on, I'm going to take a little bit of a left turn detour here, but a lot of
Mhm.
the research on like foam rolling and self myofascial release says that we actually don't have the ability to cause enough pain that would like self inflicted pain that would
Mhm.
actually help do what foam rolling and SMR needs to do, right?
Mhm.
So what that translates into is having someone else, you know, massage, having someone else go in and address tissue restrictions is going to be more effective than doing it yourself because you physically just can't induce the needed pain that would
Mhm.
have to happen, right?
Mhm.
But to take that a step further, my husband has a lot of certifications and he's also a chiropractor. For those of you who are listening, we met in chiropractic school, but he has a lot of certifications in soft tissue therapies. And something he does is what he calls the hardcore four. And he will just beat on you for 4 seconds and then release, and beat on you for 4 seconds and then release. And my husband is a phenomenal resource for people with chronic neck pain, which is something I've struggled with over the years. I've had over the years just certain like episodes where I'll wake up and you like are that like robot, like, oh my God, I don't know what I did, but I can't move. I just woke up like this. Somebody help. And he's really great at helping release that because a lot of times your brain just needs to be tricked into, oh, that muscle is actually okay. We're all right. Like, let's calm down. Let's take a second. Right. And that's a lot of times what that soft tissue therapy is used for. Now, again, everything just like any diet, right? Everything is just like a tool in a toolbox. If I see a nail, I'm not going to pull out a screwdriver, right?
Mhm.
And that's the same thing when we're talking chiropractic adjustment, rehab, soft tissue therapy. And I think soft tissue therapy, there's a lot of like talk about breaking up scar tissue and breaking up all this stuff, right? Like scar tissue has the tensile strength of Kevlar. You are not going to break up scar tissue with a damn foam roller with someone else's hands. Like, that's not what happens, right? Again, there's a response in your body's neurology that can be super helpful in getting you out of pain and helping you move better in, immediately afterwards, moving and doing rehab. Like, there's so many things that it's used for, but at the end of the day, it doesn't change the structure of tissue. Again, from what I said a few minutes ago, if you want to change the structure of tissue, you have to be doing movements. You have to be in the gym. You have to be loading tissue. That is the only way we change the structure of it.
So are we able to break up scar tissue with something else, like that's maybe non-surgical?
No.
No. Oh.
That's interesting. I'm
Yeah.
I'm curious so if women come to you and they are, they're seeing the work that you're doing, they're like, I am in pain, like I've been struggling with back pain, or just like, post birth, I'm in pain, and you're talking to them, you're going through all this and you're saying, well, like we need to get in the gym, we need to be lifting weights. And they're thinking, they say to you, well, I'm in pain, like this is what caused me pain. How do you go through that conversation of reminding or telling them that, like, yes, we can injure ourselves in the gym, but if we are making sure our form is good, we're being safe, like this is actually going to help you? Because I have worked with women in the past that are like so terrified of like going back to the gym or working out because they got injured in high school one time or whatever.
Yeah, and that can become really tricky. And I actually want to go back to that scar tissue question and then circle back to this. So we can't actually break up scar tissue, but what we can do is help the tissue around it move better, if
Mm.
that makes sense. So it's
Mhm.
like if you're just constantly playing tug of war, like, yeah, that's going to cause issues. But it's like if you're able to kind of mitigate that tug of war with soft tissue work, that can be done. So wanted to touch on that before we come back to this question, because it's a great question. So a big issue with pain management, and Maddy and you guys kind of both know this from just the mentorship conversations we have, is that pain is very much so psychological. When we look into pain science research, there is a heavy psychosocial component when it comes to pain, to the point where a lot of people identify with their pain. A lot of people have accepted, and this is partly because it's been since high school. This is partly because they've been told by every doctor it can't be fixed, right? They say like, well, I have pain and that is part of who I am, and I don't know who I am without pain. And pain is very much so an emotional response. There's no like measurement of pain, right? Like I can't take your blood work and say, oh, Allie has this much pain. Look, it's in her blood work. Like it's totally subjective. It's a completely subjective experience. And that can be a really hard conversation with clients, depending, how long they've been in pain, how they were injured, was it traumatic? A very specific client comes to mind that I actually shared with you guys a little bit about her in the mentorship a while ago. She was just very challenging to work with because I don't think she truly believed that she could get out of pain. She was a marathon runner prior to having her son. Her son is 12, and she is still struggling 12 years with postpartum back pain after a C-section. And
Wow.
she has arthritis in both hips because of running, from marathon running all those years before she had him. And it's just the saddest story because she loved running. It was what she just loved to do. And then ended up with this C-section and postpartum back pain, and then never got back to running, gained a bunch of weight. And here she is 12 years later, and that's just the unfortunate story of so many mothers. Right. And like, so if you're a mother and you're listening to this, or you're someone who's, considering having kiddos, I know that was a big thing in the questions you got asked, like, take care of your body now, because like when you're chasing around a tiny person, like it is not going to get easier. And if you don't have the foundations down from a habitual perspective, from a mechanics perspective, from a breathing perspective, from a nutrition perspective, like none of those basics, like it's just not going to get better.
Yeah,
Right. So yeah, I don't know if that really even answered your question. That was a bit of a
no,
tangent, but
yeah,
it's really difficult to talk about a lot of these things.
no, it does.
Yeah.
And I feel for this client of yours, because it's really hard to be able to come back from something that it probably was really traumatic. In a lot of cases, my friend had a really, really traumatic childbirthing experience, and she went through so much physical therapy after, and it just was intense. And she now, doesn't have any pain, post birth, but she is so traumatized by the whole thing. So then to add on taking away something that you loved, that was part of your identity, and just being riddled with the pain all the time. And I don't think a lot of people focus enough or understand the psychological component of the pain and imagining their life without it. That is so interesting, and that's like a whole deep dive in itself. That's
Yeah.
really
And it's the same
interesting.
as like, working with fat loss clients. If you have a client that's been, the age old saying, I've been big my whole life.
Yep.
Well,
Mm.
shit. It's like now it's part of who you are. That's really hard to overcome, and I think the more I dive into like how to help people, and again, going back to one of the earlier questions, like I don't think if I was in the virtual space, I would have ever dove down. Like the way we actually help people is by helping them change their identity.
Mm.
Like that's what
Mhm.
we actually do, no matter what your focus is. If it's pre and postnatal, if it's fat loss, if it's, people in pain, like whatever it is, you're actually rewriting people's identity, which is really freaking hard.
Yeah.
I saw a quote by his name's Dr. G Gonzalez, I think. I don't know if anyone follows him, but he's a good follow. And he said, "You cannot heal someone who feels most safe in their story of being sick."
Mm. Yeah.
Which is literally this conversation to a T. I'm sure anyone listening, including you guys, probably have someone in your life who is in pain for some reason, and you offer help or you suggest, or, it's falling on deaf ears because they are comfortable in their story of being sick and my
Yeah.
back is hurting all the time. I'm overweight and that's just how it is. And so I just thought that was really relevant to what we're talking about, but it's true. You can't help them.
Yeah. And I even feel like that was my narrative a little bit, like when I first was like diagnosed with like agoraphobia, like that was my personality. Like, like
Mhm.
you make fuck, now this is like embarrassing. I was gonna come up with a really great thing, but like, you see on TikTok, like, oh, they make, drinking out of a Stanley Cup their personality. Like, that was me. Everything was
Mhm.
like anxiety and like it's just me and like I'm just like fragile and like and like looking back like 4 years now, I'm like, okay, girl, like that was a lot. But I can also empathize with like being like it takes over and it almost feels safe in a way to just be in it and be like, yep, this is me. This is what I know. Because if I try and break out of that, if I try and do exposure work or, fix the pain problem, like I don't know how that's going to go. And it already feels scary. It already feels in pain. But like, what if it gets worse? So I
What if I
totally,
fail? Yeah.
yeah,
Mhm.
yes, like
Mhm.
constantly, like, and the same thing goes for like weight loss. Like, the big thing that holds a lot of people back is like, what if I fail? And that was even for fuck's sakes, me. Like, I'm sitting in my house. I'm on like Zoom with Kelsy and I'm like sitting there, like trying not to cry. I'm like, I just like have been really afraid to like not fail. And like, she's just saying all the things I need to say. And in my logical brain, failing is not necessarily like, it's not a thing. Like, you can have setbacks and it can feel like it's not going to work. But unless you fully stop, then,
Mhm.
failing is like, kind of not gonna happen. And so it's just so interesting to like look back on like even in my own experience of like the times where I was like, I'm just gonna be stuck because I am afraid of failing and it not getting better. So I love that quote. That was good.
I know. And it's funny because when you're talking about Kelsey about how pain is like so much in our memory and like in our DNA, for lack of better words, like when I tell you I've had low back pain my entire life, I have had low back pain my entire life. My
Mm.
entire life. And like a part of me in reaching out to Kelsey and like literally, I can't remember how we started. I remember you asked in our one mentorship group, you're like, anyone planning to be pregnant soon or is pregnant or whatever? And I was like, well, what if we don't want to ever be pregnant but have pain?
Like, I can help you too, Maddie. Come on over.
I was like, I have issues. And like, even when I messaged her and said that, like, I was like, I'm still going to have this pain. Like, I feel
Mm.
like I almost have, what's that thing that soldiers have where they're like missing an arm and they like feel
Oh,
their
like
arm
phantom
hurting?
Phantom
pain.
limb syndrome.
Yes,
Yeah.
yes.
Yeah.
I definitely have phantom limb syndrome when it comes to my low back. I'm like, is it hurting today? Does that bother me? But the
Allie's
pain has
face while you're saying that is so funny. Alex, like, whoa.
that's just a little snippet into my Delulu mind. But I have had this pain my entire life, like my entire life. So many doctors have told me, people, that, oh, it's just, this is how it's going to be. And to have it improve exponentially in the past how many months is amazing, obviously. But like, there was a part of me that was like, it's not going to improve. It's going to stay the same. And then you can apply this to anything, whether you are, trying to lose weight. Oh, this diet, it's not going to be any better for me. It's not going to be better. I mean, how many times Allie and Kelsey do get applicants and they are like, I've tried everything. I mean, we'll see if this works, but I've tried everything. Right.
Yeah. Like
That's like,
all the time. It's like a
yeah.
default answer in a way, because
Yes.
I think when I read those, it's almost like I'm giving myself an out. Like, I know it might not work,
Yeah.
so I'm letting you know that. So if it doesn't work, I already knew that. So it's like I'm right. And yeah,
Yep.
all the time.
Yep. Yeah. And it's just being open to, okay, this can change, and being open to like a new way of thinking. Like, if I am like predisposing myself, like I'm going to do deadlifts, like now when I do deadlifts, I rarely have back pain. But literally, I would know if I see deadlifts on my programming, oh, the next morning it's going to be rough. It's like I thought it was going to happen already. So I almost wonder, did I like conjure the back pain while I was sleeping, while I was thinking about it? Because I thought it was going to happen, crazy.
Not conjuring back pain. I'm like getting terrified. I would have said like manifested, but this bitch is like, no, it's the devil. Like I am conjuring this back pain. But I wonder, like, Kelsey, do you find that people have maybe a harder time, like that, having a harder time letting go of that pain if they're constantly thinking like, no, this is not going to work. Like, I'm not fully convinced, like kind of like what Maddy was saying. Do you find that they're still in that pain because like the psychological component of it?
Oh, 100%. Absolutely. Right. Like, I mean, if I say like, hey, don't think about pink elephants, like,
Yeah.
what's the first thing we all think of, right? Like, if whatever is going on up here is absolutely what's going to happen in the outside world. And Maddy, I think it's interesting that you have had that experience, because I feel like from my perspective and where I'm sitting, you've been so open and you've been so like willing to change and willing to make adjustments, right? When like, your perspective is like, this probably ain't gonna fucking work. Like having that going on in your head, where again, from my seat, you're like, well, let's give it a try, and I think that's the big difference. And that just goes back to the open versus the closed mindset, or the fixed mindset, right? Like when we have that open mindset, that allows us to try new things, that allows us to fix problems and actually get to the bottom of it. And Maddy, you had mentioned, in a previous podcast I listened to, I don't remember which episode, but you were talking about your mom used to complain about everything. And then you like set a rule. You were like, if you're going to like, you can't complain if you're not doing anything about it. Right. And that's just like, it's just one of the hard truths that people need to hear. And I think from our seat as coaches, it's really hard to know when your client needs to hear that versus when they need like it's going to be okay. Like, I'll be here to hold your hand. Like, and that's something I feel like I struggle very much so to read. Because my like go-to is exactly what you're saying, right? Like, hey, well, you haven't done anything about it, so we can't be surprised here. Let's, that's kind of like my attitude. Allie and I are both New Englanders, so we have that like edge to us. But yeah, that's hard. It's hard for me to find that like balance, of what someone.
Speaking to the choir, and to be fair, I was only like, this is not going to work before. Once we started working together, I was like, okay, I'm open to change. But for a while, I was like, I'm unfixable, But
because that was like your story. Like that makes so much sense, because that's what and especially like, getting sick in like your formative years, like being a young person, like makes total sense.
Yeah. And what was I going to say? I struggle with that line too of like, one of my things, and Lacey, who we all work with in some capacity, I remember I would ask her like I would send her a post, just a post to social media and be like, do I sound like a bitch? I would ask because I'm so afraid of sounding like a bitch. But like in reality, like the way we deliver things can be interpreted differently by someone who's just having a bad day, having a good day, having whatever kind of day. So I think as long as we are, not that like you guys need coached on this, but like what I tell myself is like I'm delivering it with love because I care about them. And then I think that for me makes me feel like it's not going to be what they don't need to hear at that time, if that makes sense.
Mm,
Yeah. I had
yeah.
posted something a while ago that reminds me of this, and kind of what we were talking about in the beginning of like a lot of moms, like it's just their story that they, end up in pain, and then they don't know what workouts are going to hurt. So they don't work out and they gain weight and they can't do what they used to do. And like, that's just their situation. So there's a stat out there that 57% of US moms are overweight.
Wow.
57%. And I had maybe a year ago now created a piece of content about this. And I remember because at the time I was pregnant,
Mm.
and I created a piece of content about this. And this one woman came at me over this post and this statistic. And she was like, well, I had this disease, whatever, and I had to be on bed rest and blah, blah, blah. And I was like, I'm very sorry that happened to you, but this is like just a stat. Like, this is
Yeah.
just a number. Like, I didn't make it up. I didn't do the research. Like, this is just a stat. This is literally just a number. Like, and she was just like, and you're so triggering because you have a healthy pregnancy and blah, blah, blah. And I was like, whoa, this just turned into like being something not about what I wanted to be about so quickly.
Yeah.
But it's so true because like, you never know what someone is going to take. Like, someone could look at that stat and be like, wow, fuck, I need to get my act together. Or someone could look at that stat and be like, wow, fuck, I like that really makes me feel like shit. But it's just a
Mhm.
Yeah.
number.
Right.
Just a number.
And I
And
think
to
like, sorry, you go.
No, go ahead, go ahead.
Okay. Um, I think like both, I always say this to Maddie, like both can be true. Like it can be triggering because you're seeing somebody with a healthy pregnancy and you're doing all of the right things. And then it can also just be like, I am not responsible for your trauma. Like you like coming here and just like trauma dumping on my page is a lot. So like maybe let's like
Mhm.
check ourselves before we like go crazy in the comments. But that stat is really crazy. And it just I think goes to show like there is such like it's a bigger problem. Like learning that statistic should open our eyes to the healthcare system in general because I'm sure a lot of these moms like aren't getting the best like postnatal care. Like they're in pain. They're not getting the best answers from doctors. They're not being taken care of in a way and then it leads to all of these issues. So that is pretty bananas. That is crazy.
Yeah. Well, Allie can talk forever. Not a bad thing. So I'm pushing us to the questions because I know you're on a time schedule and I don't want to abuse your time.
Thank you.
So we
I
asked
do.
our listeners. She does. She abuses me all the time. We asked our listeners some questions, what they would want to focus on when it comes to pregnancy and health. So the first question we got is what is the most beneficial thing to do before birth? Is it not being overweight? Is it being able to do cardio? Is it having muscle? Like, what is it?
Okay, so I noticed y'all sent me some of the questions. I don't know if you got new ones, but you did send me some of the questions beforehand. And I really like thought hard about how to answer this. Like, even when something is your expertise, you're like, I want to just like nail this answer, like, and
Yeah.
so I want to break this down into 3 different components.
Mhm.
Number 1 is biomechanical, right? Like from a biomechanical perspective, the best thing you can do if you're considering getting pregnant or currently pregnant is work on 360 breathing. Okay. I have some free tutorials on how to do this. Happy to send it or post it in that Facebook group. When we are pregnant, as our bellies expand, your lungs can't get a full expansion because there's a physical blockage, aka a baby, in the way. So working on your breathing mechanics is one of the first things I do with someone who wants to get pregnant, is currently pregnant, or is postpartum. Okay, because pregnancy changes your breathing mechanics, and we breathe 24/7. Right? Like, does anyone here ever stop breathing? Like, no, it's not in the criteria for life. So like address that first. So from a mechanics perspective, start with breath. That's like number one.
Mhm.
From a nutritional perspective, when we get pregnant, your thyroid takes a beating because your thyroid is just like, we need to make more tissue. We need to make more tissue. We need to make more tissue. And so what does your thyroid run off of? Carbs. So my suggestion would be, from a nutritional perspective, have your nutrition habits down. Like, make sure you're drinking water, make sure you're eating protein, you're eating fiber, right? Because that's going to ward off issues like constipation and headaches and just all the issues that come with pregnancy to begin with. But it's also going to help your thyroid function. And a lot of women come out of pregnancy with, Hashimoto's and thyroid issues because their thyroid was not well supported prior to coming into pregnancy, right? So make sure you're keeping your calories high, even if you're overweight. I thought it was so great how that person phrased their question and saying, like, is weight loss the most important? I would say not if it requires you in a calorie deficit, because that's going to affect your thyroid. And at the end of the day, I would so much rather have someone's thyroid be healthy than say, like, oh, I'm going into pregnancy at the perfect weight, right? So that's kind of my 2 cents from the nutritional perspective. And then I also just want to touch on the third thing, is the mental and emotional perspective, because we didn't really talk much about like what Allie and I work on together in this podcast. So maybe we do have to do a round two, but a lot of times I feel like Allie and I go down the rabbit hole of like body image stuff and, kind of how we feel in our skin. And the thing is like, postpartum is like, I mean, y'all, my son is 8 months old, and like postpartum is rough. Like, there are some days that, and I'm like someone who's very comfortable. Like, I'm a super confident person. And like, there are some days that I look in the mirror and I'm like, babe, my face has totally changed since having Judge. And my husband's like, you are insane. Like, no, it has not. Like, and they're just little things that I look at my body and I'm like, oh, is that because I had a baby? Oh my God, is that like, did that change? Oh my God, like, let me look at a picture from before, and I'll drive myself like absolutely bananas. And like I said, I'm someone who has come a long way in the realm of like confidence and body image, but like that stuff after you have a baby is like absolutely not going to get better. So like doing the deep work, hiring a coach just to have these conversations with and pick apart some stories you have around your body and why you feel the way that you feel, I think is one of the most valuable things you can do to come into the postpartum space and be like, you know what, I'm going to have good days and bad days, and that's just okay right now.
Yeah.
So those
I
are the three
really
things.
like that.
That was great.
Yeah, that was
was
a
great.
really well-rounded thing. And it's like a little uh part that kind of like hit me is, I remember when I was really struggling with my body image and just really unhealthy habits, somebody said something to me that like hit me, and I was like, oh God. They were like, I really hope that when you are pregnant, like, you have these things figured out, because I'm nervous for you to gain that weight and feel, so uncomfortable in your body. And like, how many professionals like yourself are talking about like the three components? Like, it is not just your nutrition. It's not just like, beware of gestational diabetes. Like, we need to actually cover all of these things. So I loved that answer. It like really, then like I told Kelsy, I was like, when, I'm working with you till like I get pregnant, have a baby, and then after, because like I don't trust anybody as much as I trust Kelsy.
Oh, that means so much. Thank you. But like, yeah, I mean, the reality is, no matter what health behavior we're talking about, like when you have a baby, it's not going to get better.
Yeah.
So like,
It's only going
just
to
think
get
of it that way.
worse.
Yeah.
right?
It's
Yeah.
only, and I hate to be the pessimist, but like, it's only going to get worse. So like having a handle on any of those things beforehand is going to be super valuable.
Love that.
Awesome. Okay. Next question. Okay. I know these two questions are loaded, so it's
Yeah.
okay if you have to like, again, we'll do a round two of this.
We're good. We're good.
All right. How to get rid of or minimize the apron belly from a C-section?
Okay. So if I remember correctly, there were a couple of postpartum questions, right?
Yes,
There
that's
was
one of two.
Okay. And there was one about leakage as well, if I remember
Yes,
correctly.
leaky
Okay.
bladder. Yep.
Okay. So I want to sum up I want to talk about both of those in one answer, because the answer to core issues is pressure management. Okay. Any core issue. And so I want to break that down. So your core is not just your six pack. I know you guys know that, but like some listeners might not know that, right? Your core isn't just like, oh, look at their sexy ab lines, right? Like it's way more than that. And so if we think of our core as a can, right? The top of the can is the diaphragm. So that's the muscle underneath your rib cage. Like if you hook, I'll do it for our YouTube people. If you hook underneath your rib cage, you can feel, right? It feels like really tender right there. That's your diaphragm. That's the top of the can. Okay. Your pelvic floor is the bottom of the can. Okay. And that's that sling of muscles that holds all your lady parts. Okay. That's the bottom. Now, all around the can, we've got your transverse abdominis, which nickname is the corset muscle that wraps all the way around. We've got the muscles in your lower back, right? Your paraspinals. We've got the obliques, those like side ab muscles. We've got that six pack muscle. So that's all around the side of the can. Now, if we remember that canister, okay, and that's actually your core, what we want to see is equal pressure throughout that canister with every breath that we take. Okay. Because remember, just like we talked about, you breathe 24/7. So if that breath is wonky, if that breath is off, if that breath puts pressure only in the abdomen, which, you know, that shelf, right? That like mom pooch shelf thing, right? That's putting a lot of pressure forward into the abdomen, right? If you think about that can, and every time you pumped air into that can, the pressure only went in one spot, what would happen? That spot would get weaker, right? That spot would just continue to get weaker. Whereas when we manage pressure, the whole thing expands and the whole thing contracts and the whole thing expands and the whole thing contracts. So coming back to that 360 breathing pattern and addressing breathing mechanics is what actually fixes the majority of postpartum core issues. And if that alone doesn't fix it, then that's the starting point, right? You would never give someone who's having these issues like, oh, hey, go do planks or go do crunches or go do whatever, go do any exercise, because if they're breathing improperly, those pressure dynamics are only going to be worsened.
That's so good. And like how many, you know, new moms are like hearing this type of information. It's like, let me just YouTube how to lose the mom pouch or something.
Right.
Yeah. And it's interesting because I was someone, and I said this in our mastermind the other day, that has been taught belly breathing from
me too. My therapist.
So, like from like the very beginning of my coaching, coaching career. So I have been relearning how to breathe correctly for, as long as I've been working with Kelsy now, and it's still a struggle for me. And if I had kids, I don't want kids, but let's say I wanted them and had them, I guarantee you I would have leaky bladder. I guarantee you I would have a mom pooch because I still struggle with 360 breathing and learning how to use my entire body and not just like puff my stomach out like a sumo wrestler, because that's what I was taught by a chiropractor like way back when.
Yeah. And then if you think about too, like the leakage, right? And that being an issue, if you think about what that is, right? We typically leak when we jump, laugh, sneeze, like added pressure, right? If you sneeze, what do? Right? Like you're adding pressure. That's what the problem is. It's actually pressure management. And there can be weakness in the pelvic floor. There can also be tightness in the pelvic floor. It's going to be very individual, the way that you address that problem. But the base of the problem, the root of the problem, if we're getting down to the root cause, is always going to be pressure.
That's so interesting. I love that.
That is. I could literally talk about this for hours. It's just like a wormhole after wormhole.
It's I think it's fascinating. Like, I'm sure some people listen to me and they're like, hit the snooze button, whatever, lady. But I think it's interesting.
Yeah, no. And you're excited to talk about it. And it's a problem that so many women deal with and aren't being educated on. And you're one of, I'm sure there's a bigger, there's more coaches out there that are aware about this, but like, I'm not getting fed that content because I'm not, pregnant or, have these issues. But it's nice that you are someone out there that me and Allie both trust a lot. trust our backs with. Trust my core with her.
Trust my mind with. I'm like,
Allie's Delulu, and I am like basically handicapped. Or I was.
Oh my God, y'all.
I like the amount of times I'm like, I just need to like a brain dump for a second into Voxer with Kelsey. And then sometimes I'll be like, you don't need to respond. You don't need to listen. Like, just need to like go to my safe space. But which is, definitely want to talk about in another episode with you, but just like as a teaser, like the way that we have worked together and a lot of the work that I do with my clients on nutrition, it goes so much deeper. And we really have a cool dynamic how we go so deeper. And that's going to be such a cool conversation for another day, because like, it's not, weight loss isn't just about, getting your calories in a good place. Like it's so much deeper. So that is like a little teaser and a preview, but we're watching the time. Is there
Yes.
anything you want to leave the listeners with?
Man, I feel like we covered so much. Thank y'all for having me on. This has been an absolute blast. As like a listener of the podcast, when y'all asked me to be on, I was like, oh my God, I was like totally fangirling. So yeah, just thank y'all so much for having me on. And if you guys have questions, I'm happy to send the 360 breathing resource for clients. I do have like a postpartum core guide, so I can send that over to you guys for your listeners.
Perfect.
But yeah, other than that, thank y'all for having me.
Thank you guys so much for listening or watching Kinda Hot, Kinda Healthy. Please make sure to subscribe, rate, and review us so we can reach more women just like you. You can find us on Apple Podcasts, Spotify, YouTube, anywhere you can stream podcasts. If you have a burning question about life, friendships, health, or want our 2 cents, email us at kindahotpod@gmail.com. That's KINDAHOTPOD@gmail.com. We love to include this new segment, so make sure to send us your questions. Thanks, guys. Bye.
Bye.